In this video, we're going to review phosphodiesterase type 5 inhibitors, also known as PDE-5 inhibitors. To better understand their mechanism of action, we'll briefly review the physiology of erections. So everything will start with sexual stimulation, which leads to the release of nitric oxide. That nitric oxide then acts to increase levels of intracellular cyclic GMP, which has downstream effects which ultimately lead to decreased intracellular calcium, which leads to smooth muscle relaxation and increased inflow and an erection. As you can see here, that cyclic GMP is degraded by PDE-5 and is one of the mechanisms that leads to detumescence. And the way that PDE-5 inhibitors such as sildenafil work is by stopping that degradation of cyclic GMP. So they work basically to augment but not induce erections. So they keep the cyclic GMP around to keep the erection hard and durable, but at the end of the day, we still need sexual stimulation to start everything. There are a number of side effects to be aware of when prescribing PDE-5 inhibitors, including headache, dyspepsia, flushing, myalgias or back pain, nasal congestion, and finally, visual disturbances, such as photophobia or blue vision. Of note, PDE-6 is expressed in the retina and will sometimes cross-react, mostly with sildenafil or vardenafil. One of the main contraindications to PDE-5 inhibitors are nitrates, as these medications, when taken in combination, can cause a precipitous drop in blood pressure. Regular nitrate use is an absolute contraindication, and if angina occurs during sexual activity while someone is taking a PDE-5 inhibitor, they should cease and seek immediate care. They should also let the medical staff know that they took a PDE-5 inhibitor and should avoid nitroglycerin use for 24 hours if they were taking sildenafil or vardenafil and 48 hours if they were taking tadalafil. If hypotension results from PDE-5 inhibitor use, patients should be placed in the Trendelenburg position and given IV fluids along with administration of alpha-adrenergic agonists such as phenylephrine as needed. After comparing patients who take PDE-5 inhibitors to those who don't, it was found that they do not have an increased risk of myocardial infarction or death when compared to those in a study-controlled population. Caution is advised for the use of PDE-5 inhibitors, though, in patients who have left ventricular outflow obstruction such as aortic stenosis, baseline hypotension, or baseline hypovolemia. Caution should also be exercised when prescribing these medications to patients with mild to moderate hepatic or renal impairment or men with spinal cord injury, and dosing may need to be adjusted accordingly. However, these medications are absolutely contraindicated in men with severe renal or liver disease. Other medications that can potentially interact and influence the metabolism of PDE-5 inhibitors includes antidepressants, antifungals, antihypertensives, and HIV/AIDS drugs. Patients should be aware that, in general, these agents effectively result in successful sexual intercourse at approximately 70%. Optimization of the effect of PDE-5 inhibitors requires a couple of steps, including sufficient sexual stimulation, as we discussed earlier, reducing food intake, which may delay drug absorption, escalating or titrating drug dosing as needed, and multiple attempts with the medication, up to 9 or 10 times to be successful. Additionally, correcting or improving adverse health conditions such as glycemic control, hyperlipidemic control, androgen replacement, which affect drug efficacy, has also been demonstrated as potentially beneficial. The first medication is sildenafil or Viagra. Its onset of action is about 30 to 60 minutes, and it lasts for about 12 hours. Fatty food reduces its absorption, and its side effects include headaches, dyspepsia, and facial flushing. It has less backache and myalgia side effects, and is the main culprit when it comes to blurred or blue vision. Recommended dosage is 25, 50, and 100 milligrams. Vardenafil or Levitra has an onset of action at 30 to 60 minutes, and duration of action of up to 10 hours. Fatty food reduces its absorption, and its side effects include headache, dyspepsia, and facial flushing, rare backaches and myalgia, and some rare blurred or blue vision. Of note, this medication can cause a prolonged QT interval. It is not recommended in patients taking certain antiarrhythmics such as amiodarone, sotalol, quinidine, or procainamide. Recommended dosages include 5, 10, and 20 milligrams. Tadalafil or Cialis has an onset of action of 60 to 120 minutes and can last the longest up to 36 hours. Fatty food has no effect, and side effects include headache, dyspepsia, and facial flushing, and probably the worst offender in terms of backache and myalgia, with rare, blurred, and blue vision. Recommended dosage includes 5, 10, and 20 milligrams. Lastly, Avanafil or Stendra has an onset of action of 15 to 30 minutes. It's got the shortest duration of action, up to 6 hours. Fatty food does reduce its absorption, and side effects include headache, dyspepsia, and facial flushing, rare backache or myalgia, and does not have any of the visual side effects such as the other medications. Recommended dosage includes 50, 100, and 200 milligrams. That's it for this video. Thanks for watching.